This video covers the remainder of the information that we find in Chapter 1 notes. So the objectives for this are to describe anatomical position, use correct anatomical terms to describe body directions, regions, body planes, and sections. And it's very important that we have a very good working knowledge of these terms, that we use them all the time, because we do use them all the time. You can ask my 17-year-old. She is addicted to Grey's Anatomy, which is good because she wants to be a nurse, but she has started using proper terminology because that's just what you do. They use it all the time in the show, and so she's becoming very familiar, fortunately, with these terms. The next one, locate and name the major body cavities and their subdivisions and list the major organs within them. Serous membranes, these are very important when we get into it, into that section. Serous membranes are going to help protect organs that are in each of the body cavities that we will discuss before that. And then lastly, name the 9 regions and 4 quadrants of the abdominal pelvic cavity and list the organs they contain. All right, so anatomical position is the proper orientation of the body so that we can see the relative position of different body structures to one another. And so in anatomical position, I'll show you a picture of what it looks like in just a minute. In anatomical position, the body is erect, the arms are at the sides, legs together, and palms face up. Now, this is not how you normally stand. When you stand just, waiting to get in at Walmart or something like that, and you put your arms down at the sides, you'll notice that your palms turn in towards your body. But that is not anatomical position, and I'll show you why that's not in just a minute. And so, like I said, this allows proper orientation of the body parts, or the parts of the body, and gives us a directional reference point regardless of the position of the body. So it doesn't matter if your body's hanging upside down or it's all twisted up in a pretzel or whatever. The body positions will always be the same relative to one another. So let me show you what anatomical position looks like. So in this figure, you'll see the individual here is standing, legs together, facing forward, arms at the sides, and they don't have to be that extended out to the sides, but notice that her palms are facing up. And the reason why her palms need to be facing up in anatomical position is that this bone right here that's on the lateral side of your arm, the radius, and then this bone right here, the ulna, on the medial side of your arm, the pinky side of your arm, they're parallel to one another in this configuration when your palms are up. If you let your palms face towards your body as you let your arms relax, your arms start to twist. And as they twist, the radius comes over the ulna, and the radius then becomes the medial bone, and the ulna is the lateral bone. But yet up here in the elbow, the radius is still lateral and the ulna is still medial. And so because of the crossing that takes place right about here in the middle of the antebrachium or the forearm, the bones are no longer in always the same position. So the radius is not completely lateral and the ulna is not completely medial. And so that's why this is how anatomical position needs to be. So if we go back here, then, in order to help us describe the orientation of the various parts of the body, we use directional terms. So, like it says, allow us to explain where one body structure is in relation to another. So there are 5 pairs of directional terms that we use, and you're probably familiar with these, and maybe even some of them, you use all the time. So the first one is superior, the first pair, and when we're using directional terms, we need to use one of these words, and then we need to use a pair of structures because we're looking at how they orient to one another. So if I'm going to use the word superior to describe where something is, so if I want to say my nose is superior, I have to say what my nose is superior to. So my nose is superior to my mouth. That's perfectly fine because it's above my mouth. The reason why I have to use it, I have to use another body term with the nose is because sometimes my nose is inferior. And so my nose is inferior to my eyes. But yet my nose can also be medial to my eyes. But there's not really anything that my nose is lateral to. I can't even think. Nope. Okay, so you can see how my nose hasn't changed position any. I just used the directional terms and another body structure to help orient where my nose happens to be. So that's one of the criteria that you have to use is when you're talking about a particular body part, you have to say it in relation to another body part. So these pairs are opposite one another. So superior is above, inferior is below, medial is towards the middle of your body, the midline of your body, and lateral is away from the midline, so on the outside. So medial is towards the middle, lateral's on the edges. Anterior is in front of, posterior is behind. With some organisms and sometimes in our body, anterior can also be ventral and posterior can also be dorsal. We usually use ventral and dorsal when we're talking about four-legged animals, because ventral is the stomach side and it points down, and then the dorsal side is the back side, but it points up. And so we don't have that orientation in humans, in bipedal organisms. So anterior in front of, posterior behind. But we also are going to use ventral and dorsal when we talk about body cavities. So kind of make sure you know the two. All right, proximal is closer to the main part of the body, and usually we use this with appendages. So if I'm talking about my arm, for example, and I want to say that my elbow is proximal to something, I need to describe it in relation to something that isn't as close as my elbow is. So if I want to say my elbow is proximal, I would say my elbow is proximal to my wrist, because it is closer to the main part of my body than my wrist is. But then I can turn it around and can say my wrist is distal to my elbow. And we use proximal and distal a lot when we're talking about bones and muscles and things like that in our appendages, because we do use proximal and distal a lot. So make sure that you know those two really, really well. And then the last pair, superficial and deep, or external and internal. So superficial are those things that are closer to the surface, and deep is things that are away from the surface. So you could take your arteries and veins, for example, and you could say your veins are superficial to your arteries because your veins are closer to the surface than what arteries are. And then you can say arteries are deep to veins. So anything that might be over the top of something, let's see, my kneecap, my patella, is superficial to my femur, or your thigh bone that your patella sits on top of. Ooh, that was a really good one. I hadn't ever thought about that one before. So yeah, your kneecap, your patella is superficial to the femur, to the distal end of the femur. Oh, I like that example. Really good. Okay, so things that are over the top of something would be like not above, but actually over the top of something would be superficial, and then the things that are found underneath them would be deep. All right, let's take a look at this picture first, and then we'll go back to the notes. So in this picture, we have what are known as body planes and sections. When we do an examination of where things are located within the body, or even outside of the body, we like to cut them into parts so that we can make equal halves. It doesn't have to be equal half, but that we make halves. And so we have three body planes or sections. We have a frontal plane, we have a mid-sagittal plane. I don't know why this is medial, because we never use medial. So frontal or coronal plane, mid-sagittal or sagittal plane, and then transverse plane. So if we take a look at a frontal section, how is that going to divide this person? Well, it's going to divide the person into front and back halves. So here we've cut off the front of her, so her rib cage and abdominal wall have been removed so that we can see the structures in the back part, but she's still facing forward. So here's the orientation of the lungs, here's the heart, here's the stomach, here's the liver, some small intestine stuff, spleen, probably ribs over here. Here's the head of the femur they cut through. So this is a coronal or frontal section. The second one here is a transverse section. This lets us see top and bottom. When you are doing a a CT scan on someone and you're running them through the scanner, this is the kind of image that you're getting. You will get transverse sections of a person, and if we take a look at this section right here, we've cut her through this area, well, a little bit higher, through this area right here, and we are looking up. This is looking into her body, so her head would be going into the screen, and then if her legs were still present, they would be coming out of the screen at us. And so this is the top of her, this is where her chest and her abdomen would be, this is where her back, because here's her spinal cord, there's her vertebrae. So here's her vertebrae, the rest of her vertebrae, and there's her spinal cord in here, here's the aorta, and the inferior vena cava would be over here. Here's her pancreas, liver, gallbladder, spleen, intestines. I just finished a diagnostic imaging course. I'm taking some graduate courses, and I just finished that. So I've spent a whole semester looking up underneath people and looking at these images. So I feel really comfortable with this picture. I like it. Okay, and then we have, same with the mid-set, well, same with all of them, coronal sections and transverse sections and sagittal sections of everything. So mid-sagittal, sagittal means to cut down, creating, so this creates a top and bottom half, a transverse section, and then a sagittal section is going to give you a right or a left and right half. In her case, this is a mid-sagittal plane because it's cutting her right down the middle into equal left and right halves. So this would be a right view. So this is anterior right here, this is posterior here. Here you can see the vertebrae. Here's her sacrum and her little tailbone, and coccyx over here, and the rectum and the pubic bone and the bladder and the transverse colon and small intestine are all right there. Okay, so those are the sections. So frontal or coronal, I go back to the notes, and transverse and sagittal section. So let's look at what we have in the notes. So coronal is usually the one that we use, but you may see either one of them in a question. So coronal is like a crown on your head. Divides into front and back halves. Sagittal divides into left and right, but mid-sagittal divides into equal left and right halves. And transverse, you may see axial, but probably never. Transverse section divides top and bottom halves. Okay, then our body cavities. So here's where we actually use dorsal and ventral in humans. So the dorsal body cavity is everything in yellow here in the back of you. Now I know your head is, it's in the back and the front, but because it's connected to this cavity here in the back, then we consider it part of the dorsal body cavity. And then the red areas are the ventral body cavities. So within each body cavity, there are further subdivisions. In the dorsal body cavity, we have the cranial cavity, which would contain the brain. And then we have the vertebral or spinal cavity, which would contain the spinal cord. And so those are the two subdivisions of the dorsal body cavity. In the ventral body cavity, we have the thoracic cavity, which is up here in the top. And we'll get to this view. Let's just look at this sagittal view first, or lateral view. So here's the thoracic cavity, which contains the heart and the lungs. Now there is actually a physical division or separation between the thoracic cavity and the abdominal pelvic cavity down here. And this is the diaphragm. So the organs that are contained within the thoracic cavity never, unless you've got a mistake, which can happen, never come down here into the abdominal cavity. And actually there are some birth defects where the diaphragm doesn't close in its formation, and you may actually have abdominal organs up here in the thoracic cavity. Then our abdominal then the lower half of the ventral cavity is called the abdominal pelvic cavity, which can then be further subdivided into the abdominal cavity and the pelvic cavity. Now, there's a little line right here, but that's not a real physical separation. That's just showing the outline of where your hip bones are, because there is no separation between abdominal and pelvic cavity. Everything just sinks down here. But there are some organs that are found only within the abdominal cavity. So the liver is up here, the stomach, the spleen, all of the transverse colon, most of the small intestines, and most of the large intestine. What else is in there? Gallbladder. Okay, and then in your pelvic cavity, then you have the urinary bladder, reproductive organs like the uterus, and the uterine tubes and the ovaries, and then the rectum as well. And yeah, I guess that's it, because the rest of the colon would be out here in the pelvic cavity places. All right. Okay, now if we take a look at the thoracic cavity, you can see that it is further subdivided into the mediastinum. We have a superior mediastinum, we have an inferior mediastinum or pericardial cavity, and then we have two pleural cavities. We will not be looking at these subdivisions this semester. We will look at these in 202 when we talk about the organ systems within the thoracic cavity. All right, so here just shows the various organs that we find within each cavity. Sorry. Okay, so the cranial cavity, brain and spine, dorsal is made out of the cranial spinal cavities or vertebral cavity, ventral, thoracic, abdominal, pelvic cavities, and lungs and heart, bounded posteriorly by the diaphragm, digestive organs, spleen in the abdominal cavity, and then in the pelvic cavity, as you can see, urinary bladder, reproductive organs, some digestive organs. Okay, now it's important that these organs be protected in each one of the cavities. So we're going to have what are known as serous membranes. So these are thin-walled membranes that secrete a fluid, and it's like a fist in a balloon. So you're going to get a double-layered membrane with fluid in the cavity between the layers. And what a serous membrane does is allow organs to move without friction, like the lungs and the heart and the digestive organs in the abdominal cavity and so on. So here is how, in general, here's how a pericardium or a serous membrane works. So here would be the body cavity, and it's going to be covered. So the outer part of the balloon, this wall of the balloon, is going to be stuck inside the body cavity. So lining the thoracic cavity and lining the pericardial cavity where the heart sits and lining the abdominal cavity, we have what is known as the parietal serosa. So the serous membrane that touches the body wall right here is parietal. Now what we're going to do is stick our fist down into the balloon. And as we stick our fist down into the balloon, you can see the balloon is touching my hand. So my hand would be the organ inside the cavity. So there's a space then between the body wall and the organ itself. And so that's going to be the serous cavity. And then the serous membrane that's actually touching the organ itself is the visceral serosa. So let me give you a practical picture of that. So let's take the pericardial cavity, which is inside the thoracic cavity. So I have this balloon between my lungs, just like this. And so this is going to be serous pericardium, just this balloon of serous membrane with air inside. Now my heart's going to come in, and the balloon is not going to open up. I am going to push the heart down into the balloon. And as I push the heart into the balloon, can you see how it comes around and touches the heart? And it sticks right to the heart. And then it comes around here and forms the wall out here. And then this is the space where the air in the balloon was. So this outer wall is called the parietal, in this case pericardium. But then as this portion of it touches the heart, it then becomes visceral pericardium. So here's parietal, that's this on the outside. And then the visceral becomes this portion right here that actually touches the heart. So in our cavities with our lungs, we have parietal pleura, which lines the walls of the thoracic cavity. We have visceral pleura that covers lungs, and the pleural cavity is found between the parietal and visceral pleurae. Then we have parietal pericardium, is the sac around the heart that does not actually touch the heart. So again, this is parietal pericardium here on the outside. And then this would be visceral pericardium. So the visceral pericardium is also called the epicardium, but we're not going to worry about that till we do the heart next semester. So you can just call it visceral pericardium. Covers the heart with a pericardial cavity between parietal and visceral pericardium. And then the last one, parietal peritoneum, lines the walls of the abdominal cavity, and visceral peritoneum covers all the abdominal organs. So remember, parietal always means on the outside, the body wall, and visceral always refers to the organs, your viscera. So if we look at this one last time, here we can see the parietal pericardium is this line outside. Here is the pericardial cavity, this little tiny space between the two, and then the serous, or the visceral pericardium, that actually touches the heart itself. Okay. All right, so here are the regions and quadrants of the body. So these are quadrants. We have a upper right quadrant and a lower right quadrant, because we're just dividing it into 4. So upper right, lower right, and then we have an upper left and a lower left. Now what those, by dividing the abdominal pelvic region into 4s, it can give us a little idea, diagnosing things, what might be wrong, because we know what's going to be in each one of these quadrants. The most common thing that we find with quadrants is appendicitis. And so if I have a patient that presents with, with lower right quadrant pain, that rebounds, so if I push in on it, it doesn't hurt, but when I let go, it hurts like the dickens, then my patient probably has appendicitis. Okay, so lower right quadrant rebound pain is diagnosing, or is diagnostic of appendicitis. Sorry, I just lost that word. How about if I have pain up here, my upper right quadrant? Probably means I have gallstones. Okay. If I have upper left quadrant pain, I don't know, it kind of if I have left quadrant pain, whether it's kind of up or lower, it could be kidney stones, because your kidneys sit right here, right? Like this line basically cuts through your kidneys. So that could, present itself. Oh yeah, my kidneys are there. So it just gives the doctor a little better idea of, what might be wrong with you based on where the pain is presented. Okay, then the regions, the 9 abdominal pelvic regions, why don't I have the names on the pictures? If they're not in your notes, then they're going to be in the textbook. So I'll probably add a little note in Canvas for the names of these. So we have the hypochondriac regions are up here. So I have a left hypochondriac and right hypochondriac, and then I have an epigastric region. Then I have an umbilical region, and then I have left lumbar, right lumbar, and then I have a hypogastric region, and then I have a left iliac, right iliac region. So again, that just cuts things up more so that we can find, pinpoint where a particular pain or issue is coming from, and then diagnose what might be wrong, what organ or something. Okay.